So I just see a lot of stiffness. Any pain with that? Try and touch the toes if you can. Right. Do you feel that tightness in the back, the legs, or both?
Mostly the legs actually today.
Let me do a graceful little dance.
Right?
A couple quick tests for the neck. Sit up tall. If I add some compression, any pain with this?
No.
If you lean the neck back towards me, any pain here? No. Or there?
No.
If I decompress, any pain with that?
No.
If we stretch,
Oh yeah.
right there.
Mm-hmm.
And
Mm-hmm.
same thing.
Yep.
One side worse than the other.
Maybe this one's a little worse than this one.
Okay. No lack of sensation.
No.
Okay. Let's see. Cross the arms over the chest. Lean back towards me. Any pain if I add pressure here in the back or the shoulder?
No.
And so I was just rolling out the big bads. I think you're okay. Any pain with this?
No.
Okay. If we stretch this leg, any pain in the back with that?
No.
But if you slash forward, good. Like, are you getting any of that round ligament pain? Like, okay, yeah. And this is going to be intense, but very helpful for you.
Okay. Okay. Nice.
And then, since it's your first time here, I also, if you're up for it, you need adjustment in the mid back and the neck as well.
I'm not gonna say no.
Okay, cool. I think this will be great. Okay, so I'm Dr. Max, Maximal Wellness Clinic here. I'm here with my good friend Rena. This is her first ever chiropractic treatment, so very exciting.
Very exciting.
And so we're going to demonstrate a couple of procedures I do for prenatal care to try and make getting ready for childbirth more manageable, less painful, easier on you. How many weeks are you now?
26.
26, yeah, so this is going to be really helpful for her. So I'll have you lie face down, please. So I've already done my exam, so I have a good idea of what we're dealing with here. Let's see. We start down here to see what sort of tension we're dealing with. Yeah, and I can see one leg is significantly shorter than the other. So most of the time that means we're dealing with some compensation in the pelvis. Really common during pregnancy. So in her case, the left side is shorter, so we're dealing with some compensation here. I'm going to get into the glute muscles here and find a ligament, okay?
Okay.
Let's see. Tender right about there.
Mm-hmm.
Okay, so we're going to bend this knee. We're going to work this ligament out. So what I want you to do is just kind of breathe nice and slowly. We're just going to work our way through. Usually takes 30 to 60 seconds to calm this down. Let me know if the pain is, say, a 6 out of 10 or more.
Mm-hmm.
We can ease up. So at this point in pregnancy, if any woman can tell you, all of these hormonal changes are making everything loosey-goosey to prepare for baby. Now, because the joints and the ligaments are getting looser, that means that the muscles and ligaments are having to work harder to hold everything together. And although that's going to be helpful during childbirth, it makes the process up there frustrating sometimes. It can be pretty uncomfortable. How are you doing?
Good. That really is helping release that tension in there.
Mm-hmm. Yeah, I can feel this ligament starting to calm down. Now when we do this, I like to move the leg back and forth to stretch out the fascia and get to different muscle layers. If we just put pressure on here, that could help ease the ligament, but we might miss some of the layers of tension here that we free up. So I can see, after calming down that ligament, that her pelvis is already a lot more balanced. So we'll see what tension we're dealing with here on this side, but I'd be willing to bet it's probably not as bad. How tender is this?
A 3 out of 10.
Okay, how much was this one?
Like a 5.
So we'll work our way through this. So how's it been being pregnant with a young boy running around?
You know, it's never a dull moment, that's for sure. But he's worth it, you know. He makes the tired nights well.
Does he have like an idea of what's going on?
He's gonna sleep in a crib in his room.
Oh wow!
So
yeah. So
yeah, he's really taken ownership of this big brother.
So now I'm feeling through the spine to see where the areas of tension are. I can see just how much pressure the growing fetus is placing on the lower back. This is probably pretty tense here, yeah?
Yeah.
How's this pressure here between the shoulder blades?
Good.
Okay. So we're going to adjust through here. So what that means is I'm going to have you take a deep breath in, and I'm going to put a little pressure through here and a little bump, okay? What that's going to do, we're going to open up these joints. You might hear a pop. Feel that sort of popping sensation. That's the gas inside the joint moving, okay?
Okay.
Doing okay?
Yeah.
With this pregnancy pillow here, I have to work through a bit more of that, but was that pressure?
Yeah.
And again. Nice. I'm going to open up the tops of the shoulders because these were really tense too. So for that, place some pressure here.
Okay.
Just kind of hold that in position. We're just going to rotate the head. Doing okay there. Nice. Oh, that was ready to go. Love it. Awesome. Hoping to coax that side of the pelvis back into balance. Most of us spend the majority of our time standing on one leg, even though we have to. I know in my case, I'm very left dominant because I'm left-handed. So we're back. Now we're going to work on a couple ligaments here in the front. So I'm going to check the front of the pelvis here just to see the general sense of movement. Is one side more tender than the other?
No.
Okay. To me it feels like the right side is more stuck. So we're going to check the round ligament on the right side first. So first find your belly button for me. So we find the belly button and the front of the hip, and then we go in between them. Take a deep breath. And out. Work our way through. And one more breath. The round ligament connects on the front of the uterus down to the pubic bone. Is that pretty tender there?
Yeah.
Okay. Is this pressure okay?
Yeah.
Okay. If we need to ease up, let me know.
It's like making me make a face kind of pressure.
Okay. 6 out of 10 we can deal with. More than that, let me know.
Yeah. We're about there.
Okay. So you can actually do this massage at home. You find your belly button and you find that bony part on the front of the hip. Go in between them and slowly breathe down through the tissue. It'll kind of feel like a chord or a guitar string. Doing okay?
Mm-hmm.
If you find a spot with a pulse on it, then move off there because there's some blood flow going through there. But if we're lucky, baby might say hello. Have you done the orange juice trick with her?
No.
Oh, that's a lot of fun. Cold orange juice. So you always go really light there, of course, because it's very tender, because, you know, we're just growing a baby. One more time. One more time, please. Yeah, well done.
Mm-hmm.
Good. More movement. Last but not least, we'll see what the neck has to say for herself. We'll get this pillow out of here. Marina's first neck adjustment. So the neck's just like any other part of the spine. That popping sound is the gas inside the joint, like when you
Right.
crack a knuckle. It may be a bit louder because we're close to the ear, but we're going to go nice and easy.
Okay.
So first we just feel around. Let's see. Oh yeah. I know where you hold your stress. Do it okay right here. Take a breath. Yeah. Do a little bounce. Good. Doing okay?
Yeah.
You can tell that hadn't wanted to move in a long time.
Right.
Once more, take a breath. Feel that difference there?
I feel amazing. Yeah, a lot more movement, less, tenseness overall, and no pain, which is great.
How's that looking over the shoulders?
Good.
Mm-hmm.
Thank you for going easy on me for my first.
Yeah, absolutely.
My
Of
first
course.
time.
And to the sides. Oh yeah, much smoother. Yeah. There's some stuff we can work on. But
Yeah.
Yeah, much better.
Not a lot of range of motion there.
So did the round ligaments, did those calm down?
Yeah. There's still like a little bit, they'll let you know they're there,
Yeah.
but I think it's probably just gonna be, part of the process at this point. So yeah, I'll try to do my own though. That's really neat. I didn't know you could do that.
I was gonna say that could be your nightly ritual.
That's right.
Yep.
Yeah.
30 seconds at least, and
Okay.
you'll just feel that kind of melt away.
Mm-hmm.
Like it does feel like an electric cord. So if you could imagine like feeling that through like some tissue or some fabric,
Okay.
and then that'll just sort of melt
Got it.
like butter.
You make it sound easy.
You'll figure it out. And you know where to find me if you have any questions.
That's right. Thank you, Max.
Yeah, my pleasure.
That's really nice.
Thank you.
Appreciate it.
I don't think we're all-
Communication, like it really makes the process really, less intimidating than
Good.
just for, a first timer who has no idea what to
Totally.
expect. So,
Yeah. I mean, I've got your head in my hands, right? So.
Yeah, exactly. Yeah. I think it's also really neat that you work on prenatal. I think that's really cool because it's always so hard to get help during that time. You know, like you're like, you're looking for somebody to just help you get through those last few months of pregnancy, and it's